Hi, my name is Sandeep Kaushik, and you're watching Health Bites with Zaita. In today's episode, we're going to talk about most common problem, which is the joints problem for a lot of people. And with me is our expert, Mr. Arvinder Singh from Zaita Life Sciences. Welcome, Arvinder.
Thank you, Sandeep. It's a great pleasure to be with you always. It's always a very enlightening experience for me as well.
Thank you, and looking forward to have great conversation to you about joints. So, my straight away question to you would be like, what are the most common joint problems we have, and is it happening over a particular age or it's happening at any given time?
Talking of joint problems, most of them are age related.
Uh-huh.
And one of the most commonest problems that we get to see all across is a problem called osteoarthritis.
Osteoarthritis.
Yeah,
Okay.
so
Yeah.
osteo means bones and arthritis means degeneration.
Okay.
So this is something which is more of age related,
Uh-huh.
and it's very common to see in people who are on the other side of 50. But of course, nowadays you get to see all kind of problems in all kind of age groups.
40s is new 50s type.
Yeah, unfortunately so.
Yeah.
But by far, the major cases of arthritis related problems are more seen on the other side of the 50s.
Okay.
And that too, there's an interesting fact if we compare there's also a difference in the male versus the female ratio.
Yeah, that's what I'm about to ask. Yes.
Yeah.
So how is it like? Is it more in males, more in females, or is it like same?
Uh, well, uh, Unfortunately, so the cases of osteoarthritis that are seen are significantly more in women as compared to men. So I would be at loss to discuss in detail so much of the scientific material on this, but definitely if we look at it on a more macronic level, women definitely are more prone for osteoarthritis.
Okay. And when you talk about osteoarthritis, what are the most common ways of treating that? I mean, what are the most innovative ways to treating that as well?
Innovation, to my understanding, comes at a very later stage.
Okay.
But I think it's always the problems always is in the basics.
Uh-huh.
So if you look at the areas which are more causative and which considerably amplify the problems related to osteoarthritis, one of them is weight gain.
Okay.
And weight gain is one of the biggest problems which speeds up the progression of osteoarthritis to a very large extent.
Okay.
Because the
So
more
you're
the
putting more
weight,
weight on your joints.
yeah, the more the weight, the more it is exerting on the joints and more the cartilages, the friction between them and the weight contributes to a large extent in increasing the degenerative process significantly.
Uh-huh. Okay. And I mean, how many stages are there in that? I mean, does it have different stages of problem, or is it like just the same when it starts?
That's a very nice question, Sandeep, because there are known four stages of
Okay.
osteoarthritis. Stage one and stage two are the ones where little bit of lifestyle modifications and some minor
Like losing weight
painkillers.
and getting some nutraceuticals, something like that will help, is it?
Yeah, I mean anything just taking care of the causative factors
Uh-huh.
like the weight. Weight is of obviously the predominant
Factor, yeah.
I would say enemy as far as the body's function is concerned.
Mm-hmm.
So that's one part. Stage one and stage two are fairly manageable with little bit of lifestyle modifications and maybe mild painkillers off and on as recommended by the doctors. But stage 3 and stage 4 are wherein the progression is significantly more pronounced,
Okay.
and it requires an intervention depending upon the case to case scenario, because every patient is unique in his own way. They have their own lifestyle, their own genetic makeup, their own way of functioning and eating, and it's
Reacting to
also,
different medicine
yeah.
also.
So they need a more personalized kind of care when it comes to osteoarthritis management, especially in stage 3 and 4.
So what kind of products you would suggest to our viewers if you are in stage 3 or stage 4? Of course, you have to take a kind of go ahead from your doctor, but then what are the kind of products they can utilize, or which can really be helpful for them?
I think it will be very unfair for me to suggest something to anybody for that reason, because ultimately it is the doctor who takes the best decision in the best interest of the patient.
Okay.
But there are options if you look at it. The options when it comes to them is starting from losing weight, and I would very strongly advocate the approach as far as weight loss is concerned, because data suggests, which is very recent, that even if somebody loses 10% of weight on the present context, the reduction in pain is very, very significant, beyond 50%.
Wow.
So that's one area where I, as somebody who looks at things more on the preventive part rather than the offensive against a particular problem, would be more suggestive. And other than that, of course, the patient gradually progresses more towards knee replacement and related areas. But in between, there is also a stop which is known as viscosupplementation.
Okay.
Now, viscosupplementation is a very interesting process, because what happens with age, as people age, the liquid between the joints, which is the main lubricant,
Yeah.
tends to get reduced significantly.
Okay.
So when the lubrication is not there, the friction increases, and the damage to the cartilages on the joints also goes up significantly.
Okay.
And that's where viscosupplementation comes, because there is a component called hyaluronic acid, which comes in pre-filled syringes, which can be injected directly into the knee joint.
Okay. And what is it called?
This is sodium hyaluronate.
Sodium hyaluronate. Okay.
So sodium hyaluronate once is a type of lubricant which is injected into the knee joint directly, and it lubricates the joint, making the movement more easy and more fluid, thereby reducing the pain also over a significant period of time. But then, as I said in my earlier statement, was that it's the doctor who has to decide what
Whether you
exactly
should
will be
take that or not.
the best scenario for the patient per se. But yes, definitely, if we talk of options, sodium hyaluronate injections are definitely a very good option for patients of osteoarthritis.
But how is it different from other treatment? I mean, is it like something really different? It really speeds up the joint relief, or what exactly is this?
So the entry of hyaluronic acid or sodium hyaluronate, I would say, comes at stage 2 and 3 mainly. So that's where the damage to the cartilage is significantly lesser, and it is more manageable. Although osteoarthritis is a problem which cannot be cured, but yes, it can be controlled, and it can be controlled very well.
Okay.
So weight reduction followed by injections of sodium hyaluronate directly into the knee joint, and which increases the overall mobility and flexibility of the joint, making the movement easy, and then gradually the patient is able to get back to his normal lifestyle for a significant period of time. Now, results may vary depending upon the kind of products, from 6 months to 1 year or maybe beyond. But
And what is the
yes,
frequency you take it like? I mean, is it like every day, every week, or
no, it's a I would say a sort of a yearly kind of injection. But what we get to see is that there are patients who are comfortable enough even for a period of 1.5 to 2 years, but that's dependent on
you want to say
individual.
one injection for like a year of relief, or like multiple injections you need?
See, there are various kind of products available.
Okay.
Now, when I talk of various kind of products, there are different concentrations and types of sodium hyaluronate.
Okay.
So it depends that what exactly is
So based
being
on
recommended.
doctor's advice and the scenario of a person, they're going to take the call on that.
Yeah,
Which one
that's
to
true.
give, and
That's true.
what is the frequency of that?
There were earlier a course of 5 injections.
Okay.
Now there are courses of a single injection in a year.
Wow. Okay, so talking about these innovative products, whenever we talk about these, there are always some side effects or maybe some precautions to, really have that optimum result. So what do you think are the side effects of this, and what are the precautions a person should take?
Talking of side effects, one of the biggest issues which one gets to see is that since there are various products of the same type available, there are some of them which are avian in nature. Avian, which means is that the hyaluronic acid or the sodium hyaluronate in those injections is derived from rooster comb.
Okay.
So since it is derived from poultry sources, people who are allergic to poultry related products may be sensitive to those kind of products. So there could be flare in those cases.
Okay.
So flare, which means is that there could be discomfort or swelling or whatever the causative reason may be. So it's always good for patients to tell the doctors beforehand if they are allergic to any kind of poultry related product.
Okay.
And the second thing is that since this is a very highly specialized injection, it has to be injected by a specialist, since it's very finely inserted directly between the space of the knees. So it cannot be done by everybody.
Okay. So it has to be done by an
So
expert.
choosing your doctor will obviously be very, very important, who has considerable experience in using viscosupplementation products.
Well, that's definitely great insight. For a lot of people, I know that it goes with the joints pain. So, to close this episode, I'd like to ask you what tips you would like to give to our viewers who are facing the knee problems, especially osteoarthritis, that what all they should do to make sure that the joints are well.
The knee joint or the joint wellness is something which is extremely important because a person is only as mobile as his joints are. So it's always good to maintain the weight well under check, and a healthy weight will save a lot of problems.
Okay.
And at the same time, keeping a diet which is healthy enough and which is rich in natural supplements is important. But most importantly is that to have the muscles around the joints well in shape. So anything which strengthens your knee joints is something, all those exercises which are very simple, and anybody, any physiotherapist or maybe anybody in any kind of a hospital will guide the patient how to strengthen the knee joints so that they add on to the power of the knee joint, and coupled with the manageable weight, it will add on several years to the joints.
And sometimes people talk about this cartilage protein. I mean, does it really help to consume that for your for your joints?
I think those are areas which are more preventive in nature. So it's again the doctor who's the best person to decide whether a patient would be suitable a candidate for those kind of supplements which are available. But yes, there are references and reports which are available, which do suggest that these kind of supplements may be of assistance. But as I said again, these are extremely technical issues, and they need a very intense understanding of the patient's overall picture and all his health related parameters before anybody would suggest. So I think let the doctor, who's the treating physician, take the call on this. What would be required on that?
Okay, thank you so much for some amazing insights about the pain, and especially the joints pain, and there are a lot of people suffering. I'm sure they're going to benefit from this. So thank you for watching Health Bites with Zaita. You are watching a very special episode on joint pains, and I'm sure a lot of you will have got amazing insights about how you can take care of your joint pain. And don't forget what Arvinder was saying time and again, that you have to consult your doctor before using any of these products or using any of these services. Thank you so much once again. Keep watching. You're watching Health Bites with Zaita. Thank you.